Hi, I'm Bob Schrupp, physical therapist.
Oh, Brad Heineck, physical therapist.
And together,
oh,
we are the most famous physical therapists on the internet.
that was his idea, by the way.
Yep.
In our opinion, of course.
I'm loaded with good ideas. Today, Brad, we're going to talk about how to apply massage to the bottom of your foot, especially if you're having plantar fasciitis. There's a specific way you want to do this, and it is often very helpful. Now, the reason I thought this was a good topic today, actually the other day, I was running, I came home, and I was starting to feel numbness on the bottom of my foot. Actually, it was on this very foot. And it was right in this area here, and I started realizing that, the reason you have numbness could be a lot of reasons, but for me it was the fascia, that tough band on the bottom of the foot was probably getting stretched, or it's maybe getting some tears in it, and the next step was going to be pain.
Sure.
So I wanted to start doing some massage before that happened. Now let me, go ahead, can I have the foot here? Nancy?
Oh,
All right.
the skeleton of a foot.
This is
of
the
course.
skeleton of a foot. This actually is the right foot. So I'm going to show you the bottom of the foot. Brad, can you lift yours up here or just put it right up on top of me here?
Oh, there we
So
go.
this is how it lines up. And this bone right here is the calcaneus. Can you see this, Nancy? And the fascia attaches to this. It's a tough, tight, band-like substance.
Right.
It attaches to the calcaneus, and then it attaches up into the fibers up into here.
It's kind of wide. It's a wider band from the...
Yep. And a good place to do the massage actually is, you can see in the calcaneus there's a bump here, and then it kind of dips off. That's why right in here, that's a good place to do the massage. A lot of people do it in the arch, I think.
Yeah.
But I think a great spot to do it is right here. And there's two ways you can do it. One, you can take your finger and put one finger on top of the other, or you can take two fingers or three fingers together, and you're just going to rub across like this.
And how hard are you going to go on that?
Hard as you can push. You're going to. Now I'm doing it on you right now, Brad, but you can do it to yourself this way too. The one that's hard to do.
I'd rather have you do it. It's easier.
The one that's
There you go.
easier to do, or easier to do if say have somebody else, is the splaying massage.
Oh yeah.
Now the splaying massage, you're actually going to start in the middle and pull out like this with both of them. Now you can do it with your thumbs, which you can really generate a lot of pressure, but you can just go across. I actually felt a little
Yeah.
rip there, Brad. Like
I don't know about the rip, but
it felt like a rough spot.
Yeah, I felt that. You know, this is interesting because just last week I got a patient that had severe plantar fasciitis, and the podiatrist gave us specific instructions to be very aggressive. He said if their fingers aren't hurting when they're done, they're not going hard enough.
Now you do have to let pain be your guide here, though. If it's
Right.
if it's too tender to tolerate this, you're going to want to ice it down.
Yep.
And maybe try it another day, or keep icing for a while.
And we do have a video on plantar fasciitis with other treatments too, so you can look that up as well.
So here's my gnarly foot, but yeah, you can start by rubbing across, going very aggressive. Again, if you can tolerate it, if the pain allows. Generally, a lot of times what we look for is that it might hurt to start off with, but if it starts to diminish the pain after a while, that's a good sign.
And sometimes you'll feel like going numbness, and that's
So,
thumbs up too.
Exactly. If you can try it for up to a minute, and if after the minute it's worse, you got to stop.
Yeah.
If after a minute it's better, then you can keep going. And again, so that's the cross right there. Now you can work up in here too, but this is usually often a critical spot.
Right.
And then you also, like I said, here I'm taking a couple of my forefinger, second finger, middle finger, and a thumb, and I'm doing that splaying. I'm pulling it, it's like I'm pulling it apart.
Trying to rip the skin apart,
Yeah.
kind of.
Yeah.
Don't worry, it won't rip.
All the way
It's,
down, you can work that.
And usually the length of time on this, Bob, I find your fingers will wear out.
Right. There's really no limit, to be honest with you. You could
Yeah.
do this for 10 minutes
Sure.
if you want to, but your fingers aren't going to hold up that long. Now there's other things you can do for this, and we have a video on that on foot pain, but we just wanted to show you the massage on this one.
All right, and if you're 40, 50 years older, the chance of this happening is probably a little
Very
higher.
good, especially if you're an athlete and you're running and doing
Right.
activities. So
And I would like to might add, Bob, if you were married, you got a significant other, any kind of foot massage is going to give you some points. Don't go too hard on that one.
that's right. Peace.